On time. Thank you so much for coming and taking a half an hour out of your life to learn some things about your health and how your body works. Tonight we're going to talk about how to succeed with chiropractic care, but how that's no different than succeeding at anything else in life. And what does it really take to get healthy? So there's nothing in life, nothing that we do that where we can accomplish growth and virtue and quality without three laws: time, frequency, and intensity. And so if you're wondering if that's true or not, let's think about athletics and think about, let's say college athletics. When you think about it, does somebody who wants to really be good at football, so good, the kind of guy that they want to play professionally, that people will lay down a lot of money to go see, do they go to college and say, well, I'll take a crack at it for 3 months, pay for a few classes and see what happens? Do they do that? No. I mean, they spend years and years training. Mm-hmm. What about frequency? Do they say, well, I'll go, once or twice a week for a while and see how it goes, and just see what happens? No, they train, they practice every single day. What about intensity? Do they go, well, does a coach let them play half-heartedly? Do they go, well, I'll do the strength training but not the weight loss? So I'll do the reflexes but not the speed drills. The coach is going to say, hey, buddy, you're either in or you're out.
He's going to say, take a lap.
And and they're always trying to drill these players to see if they can even make the team. Well, I'm not here to work you guys that hard tonight, okay? But doesn't a little bit of this come into play when, we're talking about the health of our own bodies or the health of our aging parents or grandparents? Doesn't some of this time, frequency, and intensity apply to being healthy? Like, what about the performing arts? I mean, are you going to go watch the Olympics when these people haven't practiced? Of course not. I mean, some of them occasionally look like they haven't practiced, but of course we're not going to watch it. So as doctors of chiropractic, we've stuck to the principles of training and choosing and looking at what health is, not studying disease and what brought you in here, what made you, some of your spines, the wrecks that they are when you came in. But we want to study a healthy body so a host cannot incubate diseases easily. Now that's really important in this time of COVID. Doesn't it seem to you important that it's important to be healthy so your body can't incubate that virus as easily? It is for me.
Yeah.
And so that's what we study in chiropractic. What does a healthy body look like? How do you attain health? How does a body become healthy so you don't contract disease nearly as easily? What if someone crashes and burns and doesn't take care of their health? I mean, I promise you, and I've seen this before, you have a heart attack, you're automatically put on cardiac rehab for 3 months. They don't even ask you if you want to do it. They don't ask you how many times you want to come. 3 times a week for 3 months. What about losing 100 pounds? If you wanted to lose 100 pounds, how long is that going to take?
Quite a while.
A long time.
Years.
Yeah.
It might take 2 years to lose 100 pounds. Why? Because it took you 10 years to put it on.
Yeah.
So you don't do that overnight either. So when do people stop working on the fitness of their heart that have had a heart attack? Never.
Right.
Okay? When does an athlete stop working on the sport that he loves? Never. When are we done working on the things that we know that are virtuous to our health and our lives? Never. So in my practice, in this practice, discipline equals freedom. And when you learn the disciplines and the principles of taking care of your spine, you're going to be able to use it in a lot more ways than you're able to use it before. So whether with or without me, you're going to need to learn to sleep properly. With or without me, you're going to need to learn to sit properly. With or without me, you're going to need to learn to lift properly. You're going to have to learn that postural distortion makes bones sick. So if we look at some of the postures that I see come into my office, none of these are normal except this one here. This is the one I see these two all the time. Thoracic kyphosis, head forward like this. What do you think that does to the spine? Puts a tremendous amount of pressure on it. And so I want to get you from wherever posture you are to this right here, because we know that postural distortion causes degeneration in the spine. Once you learn to take care of your spine, how long are you going to need to do it?
For the rest of
For
your
the rest
life.
of your life, okay? So time, frequency, and intensity are important here or any other center of care. That's why I put you on a schedule. That's why some people come for 3 months, some people come for 6 months, some people come for a year, depending on how bad you were when you first came in. If I play small with giving people the truth, they're going to get small quantities of results. And, you know, I have people come in here that, and I can think of some people right off that were pretty bad when they came in, and they thought they were going to be, you know, a couple of weeks and everything was going to be okay. And they had all kinds of degeneration in their spine. One woman I know had neck surgery. Her neck was hurting her all the time. You can't fix that in a couple of weeks. So joints need to be moved as close to 100% of their range of motion, okay? And I've talked about this in my report. The more joints glide in a healthy manner, the more they're going to stay vibrant for your life. So when joints don't move and they lock up, they tend to degenerate. The less strained and inflamed they become when they move properly. And this is one of the reasons I give you the home exercises, so we can get these joints in your neck flexing and extending and moving the way they should move. What happens is when a joint doesn't move right, it creates electromagnetic changes around that area that actually cause degeneration. So ligaments were actually made to be stretched. What do ligaments do in the body, by the way? Who knows?
They hold joints together.
Yeah, they hold bones together. That's one thing they do. Ligaments hold bones together. What else do they do? Anybody ever see an athlete get hurt on the field? See a ligament get torn or hurt? What happens?
They hurt, they scream.
They scream. It hurts.
Yeah.
So ligaments are very well innervated. They have no blood supply, so they heal with scar tissue. Very well innervated. So here's what ligaments do. They hold your bones in place, and they tell your brain where your bones are in space and time. So when you do this and this, the fact that you know where your head is has a lot to do with how your ligaments are talking to your brain. Very well innervated, so they hurt when they're injured. But they don't have a blood supply, so they don't heal very well. And they tell your brain where your body is. You've got lots of ligaments in your body. Now, ligaments need to be stretched, okay? They need to be compressed and distracted. So when I adjust you with that little instrument, that's what we're doing. We're actually exercising those ligaments and making them work better. So muscles need to be contracted and relaxed. They need exhaustion and recovery. This is called what? Exercise. All right? So some of you and some of my patients, when they come in, they're in too much pain to exercise, and I get that. But eventually, you want to do some sort of exercise. This means not only getting adjustments, but doing your homework. Your gait goes better, your coordination goes better the more that you use it. So discs need to be decompressed. Tendons need to be utilized. What do tendons do?
They hold muscles to the bone.
That's exactly right. They hold muscles to the bone. They also tell your body where things are in space and time. And so tendons need to be utilized. They need to be worked, all right? Now, time, frequency, and intensity is critical to getting well. That's why in my practice, we don't have missed appointments. If you need to miss an appointment, you make it up. Appointments need to be rescheduled. How many have been to the university or high school? Okay. What happens if you miss too many classes?
You're fired.
Yeah, you fail. Okay.
Yeah.
Well, here in my office, failure is a broken physiology and a sick spine and a body that ultimately deteriorates. And that is exactly what I want to prevent with my patients. Now, the problem is that the body is so resilient that you can abuse it for decades before it starts telling you things. So these football players, when they're 22, 23 years old, you think they feel the same way at that point in their life as they do when they're 45 or 50?
No.
Not at all, okay? When you talk to football players that are 45 and 50, what do they tell you?
Their bones hurt.
They hurt. They hurt a lot, right? Yeah. Yeah, they do. So this is a problem, is we can abuse our bodies for a long time before they start talking to us. So when arthritis develops, this is not when healthcare begins. This is crisis care. So it takes about 30 years of abuse before arthritis shows up on an x-ray. 30 years. All right. So just because your joint hurts doesn't mean you have arthritis. And just because you have arthritis doesn't mean you have pain. I see people with arthritis all the time. They don't have any pain in that spot. So arthritis doesn't necessarily mean that you're going to have pain. Now, it's best to begin caring for your joints when you're young. Now, we're past that. We're all past that. But how many of you would believe that if we were taught when we were young to care for our spine, it would last us longer as we get older? Absolutely. Who taught us that? Who taught us to care for our spines? Nobody. That I recall when I was growing up. Okay? So, we're taught to care for our hearts, right? What you eat right, you exercise. But you can get a heart transplant if you need one. I don't want one, but anybody in here ever heard of a spine transplant?
No.
No. We're probably centuries away from a spine transplant.
Yeah.
We only have one spine, and we need to take care of it. So here's what a normal disc looks like. This is one that's degenerated quite a bit. Okay, disc is nice and thin. That's 30 to 40 years of degeneration right there. And that may not even cause pain. So when are we going to be done caring for our spine? Never. And this is one of the things I want to emphasize to you as your doctor of chiropractic. I never want you to be done caring for your spine. So you have joints. They need attention to time, frequency, and intensity of how you care for them. Now, if your spine were on your face, would you take better care of it?
Yeah.
Most people would. Okay? So when people come in to see me, when most people come in, there's a lot of work at first. We see it a lot more intensely at first. Eventually, you will be discharged from my initial recommendations. And then you can decide how much work you want to put in to maintain your spine. Some people come in once a month. Some people come in once every 2 weeks. That depends on what you want to do at that point. The question I have is, when will you be done brushing your teeth?
Never.
Okay? Is there a point in our lives where we go, hey, I'm not picking up a toothbrush again? It's not going to happen for most people. Some people need to pick up a toothbrush, but for most of us, we're not going to stop. When are we going to stop loving our families?
Never.
It's never going to happen. So why should we stop taking care of our spine? When you think about it, our spine houses our central nervous system, which controls everything that goes on in our body. So doesn't it make sense to take good care of that? If that houses our brain and spinal cord, and what goes on in our spine affects our brain, doesn't it make sense to take care of your spine? It does to me. Okay. So, discipline equals freedom. Anybody remember who this is? Anybody remember him? He's an Olympic athlete, Bill O'Brien.
Oh, okay.
He was a decathlete. He won the gold medal probably, I think, 1992, around there. You know, so he would get adjusted in between events. Okay, so, you know, they do the high jump and they do decathletes, they do running, and I think they do pole vault. Do you think he was having like sciatic pain or headaches or between events?
Probably.
No, he wasn't. He's in incredibly good shape. Why do athletes get adjusted when they don't hurt?
So that they don't hurt.
What?
So they don't hurt.
That's one reason. It might have to do with the fact that they perform better. Mm-hmm. They function better. If their nervous system and their spine, their central nervous system is working better, they perform better. So, chiropractic is pure, it's clean, and it's simple. You show up for your appointments, you learn quantities of information that will affect your thinking. You ask questions, and when you learn things about how your body works, which you learn here in these talks, and by asking me questions, and you get adjusted, and you put those two things together, miracles can take place. There's people with pancreatic cancer who are told they've got 6 months to live, and yet 10 years later they're telling their story. What does that tell you about the body?
It's remarkable.
Well, we're not a statistic, for one thing.
It can heal.
Yeah, it can heal. And so we have our responsibility to the right things that create a healthy body. So what are some of these things that create health in our body other than getting adjusted, which should certainly be one thing? What are some of the other things?
Diet, exercise.
Yeah, what we eat is what we eat.
What we drink.
Does that matter? What we eat?
Yeah.
Mm-hmm.
Okay.
Yeah,
because since our all of our cells are made of the food that we eat, if we eat junk, what kind of cells is that going to produce?
Weak.
Not very good.
Yeah.
Okay. So we have to do the right things to create a healthy body. Consistency is really important. Now, a lot of us are broken from that, and this is what I see a lot. As soon as people start feeling better, what do? They start going back into the old habits they used to have that got them into that place in the first place. If it's up to me, I won't let you do that, okay? I mean, I can't force you to do the thing that's right, but I won't let you do that. Two things help with this. Number one is never miss appointments. The adjustments build on each other. But here's a really, really important one. Let's say you wake up and you're sick. That is exactly the time when you want to be adjusted. You want to get adjusted when you're sick. Why is that? Why would I say something like that? Right now, my wife is sick. I should really be home taking care of her. I adjusted her twice a day and lasered her. Why is it important to get adjusted when you're sick?
To heal faster.
Okay, why?
Puts everything in perspective so it heals quicker.
Nobody knows.
Nobody
Something to do
knows.
with your brain.
Okay, you're getting warm, Sandy. Okay, you're getting warm. So, do we have such a thing as an immune system?
Mm-hmm.
Yep.
Okay, so what controls our immune system?
Brain.
What affects our immune system?
The brain.
Brain, our nervous system.
Autonomic.
Where's our nervous system come out of?
The spine.
The spine, okay?
Yeah.
So, you guys, I don't think you guys have met Dr. Adam yet. He's a chiropractor who adjusts me. But he was in here earlier. I adjusted him last night. He's developing a cold. He came in again today to get adjusted and lasered because he knows that when he gets adjusted, that his body works more efficiently. So I'll just tell you what happened with my wife, Thelma. So I was in California for 8 days. I came back and she was pretty sick when I got back. And so first thing I did was I stopped by the office, got the adjuster and the laser. She could not lay down and sleep without coughing. Now, we've probably all been there at some point. So I adjusted her, I lasered her, and she was able to lay down and go to sleep without coughing. Okay? Now, she woke up coughing, okay, so she's not well yet. What did I do? Adjusted her, lasered her, she's able to lay down and not cough. So when you're sick, you want to get adjusted. That's when you do not want to avoid my office when you're sick. Now, if you have come down with COVID, I'll still see you. We're going to see you in that room and we'll both wear masks and we're going to, protect the other patients. But that's exactly when you want to get adjusted. You want to get adjusted when your body doesn't feel well because you want to stimulate your immune system to function at its best. And so that's what chiropractic will do. That's the best time to get adjusted is when you're run down. So the final issue is intensity. How do you do that? You play all out. You be persistent in pursuing health. Come to as many of my talks as you can to learn about health. I only ask you to come to 3. I would recommend you come to all of them because every topic is different. And we go over different things on all of my topics. Ask questions and do your homework. Neck traction, number 1, okay? Core muscle exercises. I may give you some of those to do. What's the other thing that I've talked about after we do an exam that's important to do at home if your body doesn't do it very well? Remember I talked about balance, being able to stand on one leg. You got to be able to do that for 25 seconds. Okay, if you can't balance, you need to practice. So you just practice just like this, up against a wall. Balance is, so you do that just maybe 3 times a day for 30 seconds. Practice neck exercises, core muscle exercises. Take any supplements that I've prescribed. This is probably later on that I will do that and only if you need those. But these are part of the intensity of getting better. It generally takes 9 to 12 months for the cells in your body to turn over. So give yourself time to get well. Okay? Your bones don't turn over in 2 weeks. Okay? It takes a lot longer for your bones to turn over. Brain cells heal slowly. So if you hit your head or you've damaged your brain, those cells can heal and they can regenerate, but they don't heal quickly. So give yourself time, give your body time to heal. If you haven't been well for 20 years, it's going to take some time to get you to turn this aircraft carrier around to get your body feeling better and to make it work better. So we want to maintain your brain and your spinal cord. All your organs are innervated by the nerves that come out of your spinal cord as well as your spinal nerves. And as your doctor of chiropractic, this is what I want to do, is help maintain that so that you can live as healthy as possible. So this is all I have for tonight. Do you have any questions about anything I've gone over? Nobody? Okay. Well, you know, as you get healthier, you may inspire the lives of your family and coworkers so they can become healthy. Now, I've seen this before. This is Mother Teresa. You probably recognize her. She inspired a lot of people by the way she lived. So as you get healthier and you're able to do more things, you actually may inspire people around you to become healthy. Okay? So that's all I have tonight. In 2 weeks, we're going to start our two-part series on menopause. Somebody asked me today why I only had one talk on chiropractic, but it took me 2 weeks to do menopause. Well, actually, I have about 5 or 6 talks, different talks on chiropractic, but it does take me 2 weeks to do menopause. So we'll do that in a couple of weeks. I'd love for you to come to that. And then later on, in about 5 weeks, we're going to do one on anti-aging. We're going to do a talk on how do we slow down the aging process so that our bodies age slowly. I don't know how many of you would like to learn how to do that. Okay, we're going to talk about it. Okay, we're going to look at what the science says about slowing down the aging process. So we'll do that in several weeks. So thank you for being here tonight. That's all I have.